Hello, everyone. Thank you for joining me tonight. I'm Arla Gustafson, CEO of the Royal University Hospital Foundation, and from my home to yours. First of all, I want to thank you for your ongoing commitment to women's leadership in healthcare as a WLP member. Secondly, it is midsummer, the first day of summer and a day in Swedish culture that is often celebrated by gathering with friends and family and celebrating the longest day of the year, often by staying up all night as the sun does not set. Tonight, I'd like to also acknowledge that we and our homes are located on Treaty 6 territory and homeland of the Métis. As we continue to navigate our new normal, and in planning for tonight's meeting, I was reflecting on last year's WLP meeting at the Acura Center, where many of us gathered after the formal meeting to watch the Raptors game and to celebrate and cheer together their victory as Women Leading Philanthropy members, as friends, and as Canadians. And as we do, as a woman leader succeeds. Although this year looks very different, we are all among the presence of so many women who are amazing women leaders who have taken the time to give back through Women Leading Philanthropy. Thank you. The past 12 weeks has definitely been one of change at the Royal University Hospital Foundation. We are so proud of the leadership of the Saskatchewan Health Authority in their preparing and delivering on what is needed to be done to protect, to test, to educate, and deliver life-saving healthcare. To our frontline healthcare workers who work tirelessly to deliver care, and to our donors who stepped forward to support what was needed during this unprecedented healthcare crisis, what I'd like to say is thank you. We did put together a COVID-19 hospital fund with our sister foundations, and together in partnership have raised over $210,000 for priority COVID-19 priorities within our hospitals. And an additional thank you to others within the SHA, the College of Medicine, and the healthcare community for your leadership and hard work. We shared a few stories with you over the past 3 months from doctors Susan Shaw, Joanna Smith, and Mary Kinloch. And all of those really gave us a sense of what their lives were like as they were on the front lines. 2 years ago, we launched Women Leading Philanthropy. And one of the ways we're able to ensure that there is an annual $100,000 grant that is awarded to one of our female leaders is because of our sponsors. Sky Planning Group, tonight's virtual network sponsor, Handy Special Events, 1330, and D&M Images. You as donors provide the $100,000. They as sponsors make sure that all the costs are covered for our events. I'd like to give a special thank you to Black Fox Distillery and Living Sky Winery for their mingle beverage that many of you received on your doorstep to make tonight even more special. Special thanks to Barb and her husband for everything that they have provided, and I know you will agree with me that the mingle is delicious. It is the perfect complement to this evening. As a huge fan of Black Fox and Living Sky Winery, and very much in support of shopping local, I will definitely stop by to pick up some more. Thank you to Black Fox also for the gift certificate you found in your bag for the free pick bucket of flowers. I am looking forward to going out to pick flowers this summer after the Gladiola Fest. And finally, to Bioriginal and Joe Vidal and his team for the hand sanitizer. We all know how important the product is and also how hard it is to find on the store shelves. So this gift comes at a perfect time. Thank you. I want to thank tonight's hosts, Honorary Chair and CEO and founder of Hilberg and Burke, Rachel Mielke, and Program Chair, Dr. Mary Kinloch, Division Head at Anatomic Pathology for the Saskatchewan Health Authority. Your leadership continues to be inspiring, and we could not be more grateful for you leading this group. Thank you to our WLP steering committee members who've continued to meet over the last 3 months in preparation of tonight's event, and who believe not only in the program and the work of women researchers in the healthcare profession, but they believe in giving back to our community. Tammy Bogard, Director of Development, Stars Air Ambulance. Brenda Bennett, Director and owner of Brenda's School of Baton and Dance. Lisa Collard, Director of Emergency Services Urban, Pre-Hospital EMS, Sask Air Ambulance and Rostern Hospital. Nicole Payne, Partner of Scott Phillips and Mason LLP. Diana Pereira, Chief Operating Officer, Handy Special Events, and retired Kaylin Schroeder from the RUH Foundation Board of Directors. Thank you for your time and commitment and for believing in the success of this program. I hope everyone has a great evening, and I hope to see you in September. Now over to you, Rachel, and cheers.
Thank you, Arla. Welcome, everyone, and thank you for joining us tonight at Royal University Hospital's Women Leading Philanthropy June meeting. As Arla mentioned, I'm Rachel Mielke, the founder and CEO of Hillberg & Burke Jewelry, and I am joining you tonight from Regina. I am also the honorary co-chair of Women Leading Philanthropy, and it is my tremendous honor to be a part of this absolutely incredible group of women who are truly making change in our province. I'm happy to co-host tonight's evening with Dr. Mary Kinloch, who I will introduce shortly, and she will also introduce our first speaker. As women, we play such a pivotal role in our world. We are donating and volunteering with community charities. We are running businesses. We are raising children. And as demonstrated through Women Leading Philanthropy, women are conducting transformative research that will affect the lives of women, their families, and people across the world. Thank you for being inspirational women and for supporting each other and this program. It is such an honor for me to be a part of this program, and as we go into a new year with Women Leading Philanthropy, I have started to see the amazing work that has come out of this incredible program, work and change that will not only impact the women in this province, but eventually the world as well. So each of you who are a part of Women Leading Philanthropy, and for those of you thinking about joining WLP, know that this is an absolutely incredible organization doing such meaningful and powerful work, especially at a time like right now. So normally at this time, we would gather together for some pre-meeting drinks and networking and mingling with our fellow WLP donors, but instead we get to join each other from the comfort and the safety of our homes and learn about two amazing women in the province, Dr. Jessica Minion and Dr. Soo Kim. I will now pass the floor to Mary to introduce our first speaker of the evening.
Hello, everyone, and thank you so much, Arla and Rachel. Thank you to the Royal University Hospital Foundation for navigating through this new way that we're networking and bringing us all together. I want to thank everybody for staying at home and making this part of the pandemic so manageable. I think that the community involvement and the dedication to it has really made Saskatchewan a leader in Canada about how we have dealt with this unprecedented time in keeping our community safe. A few months ago, you may have seen the video that the foundation sent out about how I was navigating through the pandemic. And things are slowly resuming to normal, or what we would call our new normal. We're welcoming back patients into the hospital to resume services in the safest way that we can, and trying to move forward in what life looks like in a normal fashion, with providing those other public health measures in place to keep us safe. With work, it has really cut through some of the inertia, and it made us kind of leap forward into some of the new initiatives that we had either stalled because of fear of change. So some things like digital pathology have really been pushed forward in our lab, that has let us have the opportunity to make it front and center. I think probably for anybody that's a parent, you're happy that last week was the last online schooling that you'll have to do. However, if you are anything like me, it won't matter because you just weren't doing it. I had downloaded the app for keeping track of the assignments, but it was only a couple of weeks ago that I realized I hadn't turned the notifications on. And as soon as it lit up, it was like 87 assignments that we had missed. I think she'll be fine. She's 8. So we'll just look forward to grade 3 in the fall. Tonight, I am pleased to welcome our keynote speaker, Jessica Minion. She is a female physician who holds academic appointments and degrees from the University of Alberta, the University of Calgary, and McGill in science, medicine, and epidemiology. She's a fellow of the Royal College of Physicians and Surgeons of Canada in medical microbiology. And since 2012, she's served as the division head of microbiology and infection prevention and control in Regina. In 2017, she accepted the role of acting medical director of the Roy Romanow Provincial Laboratory, which has transitioned now into the Provincial Clinical Lead of Public Health in the Department of Pathology and Laboratory Medicine in the new amalgamated Saskatchewan Health Authority. And in this capacity, she oversees laboratory testing of diseases and organisms of a public health interest in Saskatchewan. She holds a responsibility for the laboratory response to issues of public health concern and coordinates with both provincial and international organizations to enhance and promote the impact of public health laboratory activities and services. I think you'll really enjoy her message, and so we welcome Dr. Jessica Minion.
Thank you, Dr. Kinloch, for that lovely introduction. And thanks to the organization for inviting me to speak with you guys today. So what I'm going to do is just kind of go through an outline of how the pandemic unfolded from my point of view and from within the lab situation, kind of the steps that the lab took to prepare and to implement testing, and then kind of leave you with some of the challenges that we continue to have and that remain that we're working on. So it started in January, obviously, and so the first week of January, along with kind of the rest of the world, we heard that news that there was a cluster of pneumonia in China. And that did raise alarm bells. We are constantly watching for things like that. And China in particular has these interesting human-animal interactions at their markets and different places. So it is a bit of a hotspot for new viruses that arise from that interface. And then by the second week of January, things had progressed already. So China had sequenced the virus and shared that sequence with us online, and it looked kind of like SARS. So we could tell right away that we were dealing with something that was important. By the 13th of January, there had been a confirmed case in Thailand, and by January 14th, we were considering the possibility or probability of human-to-human transmission. By this point, back in Saskatchewan, we had emailed all of the microbiologists and infectious disease physicians to be on alert, looking for travel-related infections, letting them know that we were concerned and to pay attention to this situation. And by that very week, that's when the development of diagnostic tests started coming up. By January 23rd, we had a publication from Germany by Victor Korman and his group that published their version of a PCR assay. So right from the end of January, there was in the literature, due to these international collaborations, the template for how to detect the virus. So these are real-time reverse transcriptase PCR assays. So there's really 2 steps to it. The first is you extract the RNA from the clinical specimen. And then step 2, you have to amplify those nucleic acids and simultaneously detect them. So that's the real-time aspect of it. For those, what we importantly need is primers and probes that detect and give a signal for that specific virus sequence. So the designing of those primers and probes was the important aspect of this first publication. And this was followed shortly by other labs, including the CDC, our own NML, National Microbiology Lab in Winnipeg, and the group in BC and Vancouver from the BC CDC. They all were looking at that virus sequence that China had published and designing primers and probes to detect unique sequences of the virus. So the problem with this, after you have a test designed, in order to actually implement it, you need to see if it works, if it will actually detect the thing that you are trying to detect. And so with coronavirus, at this point, nobody had access to the real virus outside of China. So in order to create basically positive control material to see if our assays worked, some labs decided to basically synthesize templates of the virus sequence. And this is what we used at the beginning to validate our assays. Not the real virus, but kind of a fake synthesized portion of the virus. So, once we had that, we were obviously in the process of trying to isolate the virus itself. And so on January 22nd was the first time the US detected a case. And so that case got sent to the CDC, and they tried to culture it and isolate it. And very shortly thereafter, on January 25th, was the first case in Canada. And so that case equally was sent to the NML to be cultured and hopefully provide that control material for us. So that was the 25th of January that Canadian labs did have a diagnostic assay up and running, which was less than a month from detection of this cluster or announcement that it even existed. On the 28th, BC detected the virus in their population as well, and that was also confirmed at our national lab. So that was kind of the month of January. So in a very short period of time, we went from not knowing anything to we're able to detect the virus. So in February, for Saskatchewan, we were in the process of bringing it in to our lab. So we brought in template from BC. We decided to go with the targets and the assay that the BC CDC had designed. And we had ordered these primers and probes and were kind of eagerly awaiting their arrival. And from the world stage perspective, I would say that we were kind of waiting and watching. Like a lot of people, it was not, I don't think that it was clear, at least to me, that this would necessarily be a pandemic. There was this unprecedented lockdown in China. And, as we watched that lockdown, I remember thinking, there's no way Canada would do this. There's no way that Western countries would go this route. So let's hope they are able to contain it. There were small outbreaks in many countries, but they were mostly travel related, and people were able to detect them and kind of stomp down on them like we had done with SARS, right? There were cruise ship outbreaks, but again, there was a lot of, that was a limited setting that there was the potential that we could get it under control still. So I think that we had a lot of hope in the beginning of February that maybe it wouldn't turn into a true pandemic until it was a Thursday on February 20th that we heard about a case in BC that was related to travel to Iran. And at that point, Iran had less than 5 cases confirmed, and we knew that their testing was not widespread, and that their public health infrastructure was not great. So if there was community level transmission that was quite apparently going undetected in the Middle East, to the extent that it was now exporting cases to Canada, I think that that was the day that we realized there's no hope of going back. This is a pandemic. So despite, the WHO, didn't declare it a pandemic for another 3 weeks, but I think everybody who was watching it knew that day that that's where we were headed. So that was Thursday, and by Friday and over the weekend, the wheels were in motion to prepare in Saskatchewan. So by that next week, we were having local meetings amongst the lab department, amongst all the microbiologists. We were going through our checklists, our preparedness checklists, which as the public health organizations, we do have these preparedness plans. They're mostly, before this, they were all focused towards novel influenza pandemics. So they needed to be adapted a little bit, but we had something to fall back on. In Canada, we have the Canadian Public Health Laboratory Network, which brings together all of the public health labs in all the different provinces. And so we were having meetings urgently to discuss what was happening. And we all started ramping up our plans for testing. For us in Saskatchewan, unfortunately, the very first batch of primers and probes that we ordered came back contaminated with template, meaning that 100% of them would be positive because they were contaminated with sequences of the virus. So we needed to reorder that, start again. But by the beginning of March, the first week of March, we had successfully validated the assay and it was in place in our PL at the Roy Romanow Provincial Lab. Our first case we detected on the 11th, which was related to travel from Egypt. And by the 13th, we had our second case with travel to the USA, which also was very alarming that the USA at that point was exporting community transmitted cases. And then by March 16th was when the schools closed in Saskatchewan. So I think that, up until mid-March, I think a lot of the population was not paying close attention or realizing what was going on and how bad this was going to be. But to be honest, that was when a lot of our preparedness work was almost over. We had things in place and now it was just a matter of ramping up. So as the volumes of testing increased, we would have daily meetings up in the molecular department with the staff making decisions about who was going to do what that day, how many people they needed to bring in from other areas. And staff from across the lab answered the call for help. And so literally anybody who had previous training with molecular testing dropped what they were doing and came to help. People who were not familiar with molecular testing but could use a pipette also got in line and helped prepare specimens. Our accessioning department went all out, expanding their hours to receive the increased volumes of specimens. And it really started coming together. I think that we were really proud of the staff and everybody in the lab that came together in kind of an hour of urgency and put this together in a very short period of time. There were challenges. So a lot of the challenges at that point revolved around the supply chain of testing reagents, as well as specimen collection, so swabs. And I remember one weekend that we went into a Friday and we were out of swabs. And, orders that you put in just wouldn't show up because everybody was ordering the same thing all at the same time. And we kind of looked at each other and was like, do we need to tell people that they need to stop ordering? And we kind of crossed our fingers and hedged our bets and said, no, it should be okay. And it was okay, but it was a close call. We were down to double digits worth of tests available in a time when we were doing hundreds of tests a day. In other provinces that went through the same thing, in Ontario and BC, they did scale back on testing indications at that point, trying to conserve testing supplies. And, the other stressful thing that I think that we needed to remember is everybody in the lab was going through the same stress that the rest of the community was dealing with. Potentially even more so because we saw the modeling projections fairly early We could come up with our own, to be honest. I mean, just back of the napkin calculations, it brought people to tears looking at what we were potentially facing if public health interventions hadn't been put into place. And like I said, we all assumed that we would not do this, that Canadians would not be willing to sacrifice the way they have to really lock things down. And I am incredibly appreciative of our nation and our province and the population for being willing to sacrifice and allow us to shut things down to get a handle and get ahead of this. So since then, things have been going well. We've been able to expand testing to Saskatoon. We have acquired more lab equipment in both Regina and Saskatoon. We've been able to secure some supplies from our commercial partners, so that makes testing easier. It's not as do-it-yourself if you've got a commercial platform to do testing. And we've been able to expand lab-based point-of-care testing to 20 different regional centers in the province. So challenges that we're still dealing with, we're trying to get back to business as usual. So, the healthcare system is trying to get back to routine services and re-implement surgeries and clinics to patients. And so the lab needs to do that as well. And reintroducing that routine testing is a struggle because like I said, we just called all of our staff to drop what they were doing and come help with COVID testing. So now the staff have to go back and do their jobs, so we have to kind of reinvent and figure out how to maintain this new testing at the same time that we're doing all the routine testing. We're hopefully going to expand point-of-care testing even further. That depends a lot on test development in the country. The Spartan instruments many people have heard about in the news. We hope to be able to introduce them in the province. And serology is on our to-do list, both to implement in the province and to conduct seroprevalence surveys to inform how many people in the province have really been infected or exposed. So most of the challenges, I would say, revolve around predicting the future, which of course nobody can do, but people often ask, are you guys good to go into the next season? What if we implement, increased testing with this indication? And I have to reply to them, do you know how many tests that will result in? Because if you don't know how many tests you're going to send me, I can't tell you whether we can do them or not. So estimating volumes becomes a high-level guessing game at every corner. What's going to happen with our supply chain? So I feel like Jon Snow sometimes. I constantly go around and warn people that winter is coming. Winter is coming, and I have a feeling that it was going to be a bad winter. So are our supply chains healthy enough? Did we buy enough time to ramp up manufacturing capacity? Are there going to be border closures to supplies? So if the States stops exporting our testing materials, there's still currently limited manufacturing capacity domestically in Canada. We're very reliant on that. Will we have large numbers of staff illnesses? So if we have significant illness in this building or in the labs that are performing testing, that impacts the whole province due to the capacity. So in general, though, I think things have gone really well. And the things that have gotten us through here in the lab, I would say have been a real team approach to the entire situation. So we've been able to rely on each other. We've been able to come together and really respond in an urgent way with a sense of purpose. And that's not just in the lab, but I would say the entire public health community, both provincially and nationally. There has been fantastic collaboration and open communication, and it has really put a spotlight on the importance of public health care. And I hope that emphasis continues. I hope that people can remember how important it was to have a strong networked public health system in Canada that was able to step up and respond as quickly as we did. And then, I think that it's the importance right from the beginning that we talked about is we knew that this would be stressful. We knew that people's mental well-being was going to be at risk. And we saw that right from the beginning. People who knew what was going on were not immune to panicking over what was happening. And so, I think people need to be allowed to worry, and they need to be allowed to tap out when they need to say that, this is too much for me right now. I need a break, and I'll come back when I feel better. And I think we all need that understanding. So I think that's kind of our story. I do want to take the opportunity to give a special thanks to Dr. Amanda Lang, our virologist, who has led a huge proportion of this work at the lab and in the province, as well as Carrie Crawford, our lab director, that has provided the support to run the whole show. And our colleagues, our microbiologists across the province that have been super supportive and taken this work, as a priority. And probably last but not least, especially to our lab technologists, that they're the ones that are there doing the work for the public, and they stepped up incredibly in this situation. So that's what I will tell you, and onwards and upwards. I think everybody should be proud of the response that we've had. The lab has performed more than 52,000 COVID-19 tests so far and counting.
Thank you, Dr. Minion. Thank you for your presentation, and more importantly, for your leadership during this unprecedented time. It is not lost on any of us that work in the lab how different this response could have been from Saskatchewan without your leadership of the lab at Roy Romanow. Saskatchewan was one of the first provinces to really ramp up and provide testing to big populations. And in the early phases of the pandemic, we in Saskatchewan were doing more tests than many of the states that were having way more infections than we were. So that early phase of the ramped up testing and the social distancing, I really believe was a serious contributor to our success of keeping the infection rate low in Saskatchewan. We didn't even really touch on some of the innovation that the Roy Romanow Provincial Lab did during this supply chain depletion. So Dr. Minion mentioned that there were a shortage of supplies for the swabs, but there was also a shortage of the media, what you put the swab in to preserve the virus. And when that ran out, Roy Romanow just made it. There was nowhere else to get it, and there was no other option other than making the media or not having testing for the province. In addition to that, it was Dr. Minion's advocacy for our northern partners and communities in not just Saskatchewan, but in the Yukon and the Northwest Territories that fall under the federal jurisdiction for healthcare. And without a rapid response from the federal government, they were left in this dilemma where they didn't have supplies for testing. And it was through Dr. Minion's advocacy that she provided a sharing of supplies with our northern partners so that they could protect their own community, which I think is something that needs to be shared. I am proud of Dr. Minion's team and her colleagues, Dr. Amanda Lang, who's the clinical virologist, and Carrie Crawford, who's the lab director. I think that they're exemplary examples of women leaders. We wish them continued health and well-being on their next phase, which is serology prevalence testing, in collaboration with the Canadian Blood Services on convalescent plasma for a national project. So we're all part of Women Leading Philanthropy because we believe in the role that we play in advancing transformative projects that will impact women and their families. Women leaders are changing the world every day. We see it with Dr. Minion's lab in Roy Romanow in our own province, and we should all be proud of that change. I will now pass it back to Rachel to introduce our next speaker. So over to you, Rachel.
Thank you, Mary. Tonight, I am so pleased to welcome Dr. Soo Kim. Dr. Kim is the 2019 Women Leading Philanthropy Grant recipient, selected by you, our WLP donors. Dr. Soo Kim and her team have been diligently working on her research project, and I want to make sure I get this right, Aftermath of Mastectomy and Breast Reconstruction, Sorting Out Shoulder Dysfunction through Biomechanical Analysis over these last months. I am so excited to hear from Dr. Kim. So thank you so much, Dr. Kim, and welcome.
Thanks, Rachel. Hi, everyone. I hope you have been healthy and have been keeping well during these challenging times. Although we're not able to meet face-to-face, I'm thankful for this opportunity to be able to provide you with a brief update on our WLP project. So since January, our team was able to recruit and test 29 women with different breast reconstruction techniques. And overall, the response has been great. The participants are just so excited to be a part of our study and are grateful that our team is tackling this research problem. And equally, the clinicians who are involved in our study are also excited and have been instrumental in providing us with as many recruitments as possible. Maybe just a brief example to show how the WLP project is raising awareness of breast cancer survivorship in general and how women are developing shoulder problems after their surgeries is there's a clinic in our community that heard about our study, and they were inspired that they decided that, yeah, you know what, more information needs to be put out there for breast cancer survivors. And so they initiated and developed a webinar for breast cancer survivors that's going to be made available on June 25th, which I think is great. I don't think that back in January when I provided an update that any of us could have imagined the impact that COVID-19 would have on us globally and on our lives here in Saskatchewan. And so I'm certain that you can imagine that the impact to the university and for researchers like myself has also been tremendous. When the university closed down in March, that also meant that all research labs had to be closed and research had to be halted. So the week that the university closed, we had 4 women booked to participate in our study, which unfortunately we had to cancel. And we're not quite sure when we'll be able to bring them back to campus to resume testing. So despite these hardships and these hurdles that we've faced, what our team has decided to do is that we would analyze the data that we've collected so far. And I think we were fortunate that we were able to have a great recruitment from January to March. And so we're analyzing the data on the 29 women that we've collected and the 16 women from a previous pilot study that we did. And although we're not able to analyze the data according to the breast reconstruction techniques, for now, what we've done is we're sort of analyzing it as a bigger group. And so we're taking the data and we're comparing it to women that have had mastectomies but no reconstruction, and also to a group of healthy controls. And so based on our data analysis, we've come up with 2 papers that we are hopefully going to be able to submit to 2 different journals in July. And the findings have been exciting because we've learned things about the shoulder that we didn't know previous to this study. Another exciting update that I want to provide is that our team decided to develop an app. And so this app project is going to make exercises for the shoulder available for breast cancer survivors who have had breast reconstruction techniques. And these exercises that we're putting on the app are a direct result of what we've learned from the previous part of our study, which is really exciting. We hope that this app is going to help overcome the barriers, particularly in this COVID-19 environment where women have difficulties with accessing services. And so we're looking forward to being able to share more on this app project at our next update. So although the university has implemented plans to reopen the university's labs and to allow certain research to resume, we're still not quite sure what that means for our team. And so we're taking it really week by week. And we're staying focused on our goal, which is to improve the lives of breast cancer survivors and to improve shoulder function for these women. So as you can see, ladies, the WLP project has been very helpful for us to be able to do this research. And if it wasn't for your generous donations and your passion to see research dollars being allocated to women's health issues, our project really wouldn't be possible. And so again, on behalf of our team, we want to say a sincere thank you again for all that the WLP has done.
All right. What an amazing update. Thank you so much, Sue, for the amazing work that you're doing for women in our province. I can't wait to hear more about the app at our September meeting. I am confident that by the fall, the research is going to be raring to go over at the University of Saskatchewan, and we can't wait to hear how you're changing the lives of women in our province. As a wrap up, I want to thank everyone again for their safety and for their protection of our community. I want to thank again our sponsors. I was very pleasantly surprised to find the goodies on my doorstep, so thank you so much. Lastly, and most importantly, I want to thank the donors. Without you, we couldn't provide any of these transformative projects that are going to be really impacting the lives of families that come to the Royal University Hospital. We're going to see a lot of sustaining changes from these projects, and that's really all due to your support. If you're not a donor or if you need to renew your membership, you can do it at ruhf.org, and it has all the information there. And you'll be able to find a recording of tonight's events on the Royal University Hospital Foundation's website, and you can share it with your friends, and we can welcome other donors into this group. So I look forward to seeing you all in September, and bye for now, and hope to see you soon.